A punitive damage award can turn an individual person into a scapegoat, someone to be taught a lesson on behalf of the entire class of victims of conduct like his or her own. Punitive damage awards, I think, drive up costs unnecessarily while forcing healthcare professionals and hospitals to focus on practicing defensive medicine. Okay? So I think it's clearly the case that the effect of punitive damage awards can be exaggerated, but I think there's something fundamentally mean-spirited about such awards, and clearly they can dramatically drive up costs. Political factors drive up the costs of healthcare dramatically. At the same time, it's important to see that they limit access to care by driving down the incomes of people who might want access to care but can't afford it. Sales taxes and similar taxes impact even the poorest people. And state and federal income taxes certainly reduce the resources available to the working poor and to blue-collar Americans. In addition to this tax burden, the direct impact of this tax burden, these taxes indirectly confer special privileges on the various beneficiaries of the spending they make possible, right? I mean, they're used to subsidize, they're used to allocate resources to politically privileged groups. Special privileges exert other negative consequences on economically vulnerable people. Some kinds of jobs require business licenses or other kinds of permissions from local authorities to start up, or not so local authorities. Maybe the licenses require costly and dispensable equipment or costly certification. Maybe they just involve prohibitive upfront costs. I mean, think about, to take the obvious example everybody always mentions in these connections, think about how much it costs to obtain a New York taxi cab medallion. It can be, over $100,000. Sometimes these licensing requirements preclude people from using the low-cost facilities that are their own homes, using these facilities for business purposes, imposing the heavy burden of working elsewhere. And sometimes, as when Tulare, California officials recently shut down a little girl lemonade stand because it didn't have a license, licensing requirements are simply exercises in petty tyranny. Now, whatever their form or their motivation, the burdens that are created by licensing requirements fall hardest on poor people. These same requirements impact where poor people can find housing. Housing that doesn't meet someone else's standards of middle-class acceptability is denied to poor people who could pay for it, but who might be unable to pay for anything else. These requirements are often sold as if they were in the interest of poor people, but clearly they're not. They deny poor people access to housing. They're primarily in the interest of the building industry. And the burden on the poor is only increased when certain kinds of jobs are denied to people at all. This matters too. Think about selling medications in locations other than legally approved pharmacies supervised by licensed pharmacists. Now, tariffs, fairly obviously, also hurt poor people by significantly increasing the costs they need to pay for imported goods, including, often enough, of course, food needed for good health that would be less expensive than domestic alternatives absent import duties. Clearly, one of the biggest rackets in the global economy today is the way in which Western powers impose limits on agricultural imports for the benefit of their own farmers in ways that simultaneously hurt poor food consumers at home and at the same time poor food producers abroad. Now, though often touted as propping up poor workers' incomes, these tariffs serve primarily to boost the profits of poorly performing domestic companies at the expense of both domestic consumers, especially poor ones, and foreign producers. It's bad news. Politically guaranteed privileges are responsible in multiple ways for many corporate profits. In an environment in which this is so, unionization can help to improve workers' economic positions. So legally imposed limitations on union activity can tend to reduce unions' influence and so to reduce the incomes of workers who might make more were they free to engage in more radical bargaining tactics. And of course, the executives and major shareholders of the largest corporations control an enormous amount of wealth because of subsidies and cost-plus contracts and the insulation from competitive pressure created by patents and tariffs. Absent the illegitimate privileges these members of the elite receive, the wealth concentrated in large firms would doubtless be more widely dispersed. That's certainly worth remembering as well. And if it were more widely dispersed, obviously it could well be in the hands of those who need it to purchase health care. So if we want to support structural political changes that will make healthcare more affordable and accessible while increasing choice, we should support legal changes that would eliminate legal protection for patents, really crucial, end the FDA approval process, along with all other attempts to use the force of law to limit the commercial accessibility of remedies desired by healthcare consumers. Eliminate hospital accreditation and professional licensing rules. Really crucial. Limit malpractice awards to actual damages plus reasonable costs of recovery, including, I think, reasonable legal fees, but without punitive damages. Repeal legal constraints on the sale of insurance across state lines, also quite important. Eliminate legal rules preventing the operation of what amount to insurance schemes by health professionals who aren't licensed insurers. Alter the federal and state tax codes to de-link employment and insurance. And eliminate agricultural subsidies. All of these things would make a real difference. More broadly, concern for the poor should prompt us to boost people's incomes and so their access to health care by supporting legal changes that would eliminate licensing, zoning, and related restrictions that help to keep people from starting small, low-capital businesses. Eliminate rules that prevent poor people from entering businesses the law currently treats as off-limits to everyone. And rules that force poor people to choose between the kind of housing middle-class planners and neighborhood busybodies prefer and no housing at all. It's a real problem if the standards aren't set by the consumers but by somebody else. Eliminate import duties. Reduce or end tax burdens that fall primarily on poor people, sharply increasing the standard income tax deduction and the earned income tax credit. Obviously, this isn't an anarchist solution by itself. I mean, an anarchist solution is to eliminate the state and to eliminate the tax code, but we're talking about transitional stuff here. Repeal state limitations on collective bargaining, including compulsory arbitration requirements, prohibitions on secondary boycotts, back-to-work orders, and right-to-work laws. Here's a radical redistributive measure rooted in the thought of the great anarchist thinker Murray Rothbard and his compatriot Karl Hess. Treat as unowned any firm that is dependent enough on special benefits conferred by the state, think subsidies, tariffs, patents, and other monopolistic favors, to count as a creature of illegitimate privilege. Treat it as unowned and spread its wealth to ordinary people, mutualizing it by allowing its workers to homestead its assets just as they might any other unowned property. So the approach that I've outlined here would ensure that poor people had more money. By eliminating monopolies and quasi-monopolistic market distortions like tax subsidies for particular insurance choices, it would also ensure that less money was spent overall on healthcare services, and this is important, that the costs of such services for individuals were much lower, and that these services were thus much more accessible. At the same time, it would preserve choice, avoiding top-down rationing. It would help us make significant progress toward reaching all three of the healthcare reform goals we have good reason to want. Most of the options that are currently on the table call effectively for tinkering with the existing, deeply flawed American healthcare system. They leave many elite privileges and monopoly profits intact. By contrast, the approach I've suggested here would be anything but a continuation of that deeply flawed status quo. Indeed, it would be a dramatic attack on the status quo, one that redistributed wealth from privileged monopolists to ordinary people and dramatically increased the likelihood of access to inexpensive, high-quality medical care for all Americans.